Our third speaker of this evening is Shannon Kenrick-Rochon, a nurse practitioner who currently practices in primary care, concussion care, and hormone replacement. Reflecting on her experiences in nursing, she will discuss the important role that nurses play in the team sport of healthcare. Welcome.
When you tell someone you're a nurse practitioner, one of two things happen. They show you a weird rash, or they ask the other question, why didn't you go to med school? I had a very hard time answering this question for a long time, and I do still joke that I'm going to do my PhD so I can call myself doctor like everyone else. Nursing is often relegated to a subordinate role in healthcare and is definitely not accurately portrayed in most media. Nurses are really scientists. We observe, we make changes, we document. That is the fundamentals of the scientific method. Often the contribution to healthcare from nurses is hidden in the in-between moments. One thing we take for granted, and we should all be very familiar with these days, is hand hygiene. That actually came from a nurse who, based on the scientific observations, Florence Nightingale recognized that hand hygiene was important. Florence Nightingale is really the founder of modern nursing. Nursing was a purposeful choice based on the journey that I wanted to take with the patient. Same as someone chooses engineering, the same as someone chooses a trade. Each role in the medical profession brings a lens to their perspective, which contributes to the overall concept of what healthcare actually is. None superior to others, more like pieces of a puzzle that fit together to show the whole picture. As I reflect on my 18 years of nursing, each area has given me different moments to reflect on. I started my career in the emergency department. I went there for the high-paced environment. What I learned was that the emergency department is really a window into humanity. You are there to share some of the most traumatic instances in people's lives, and that is a privilege. You will never forget the cry of a mother who's lost their child. You will also never forget the look in someone's eyes when they realize they're not alone. You are with someone often on the worst day of their life, or at least the week. Being part of those intimate moments is a privilege in nursing. It is where the concept of caring came from. And believe it or not, there are theories in everything, including caring. Jean Watson's theory of transpersonal caring tries to define nursing, that nursing is really beyond medical cure. Diseases may be cured, but illness will remain if caring doesn't happen. Without caring, health is not attained. It is really the relationship and the responsiveness between a patient and a nurse walking that journey together. When you're studying nursing at the undergraduate level or the graduate level, I refer to these as the touchy-feely courses. And trust me, no one is more shocked than I am to be standing up here talking about nursing theory. I then moved on to management at the hospital, and I really enjoyed speaking with colleagues and patients across the whole facility. And what I came to understand was a common experience is that patients' experiences largely depended on their experience with nursing. Nursing was the 24-hour lifeline that was with them. What nurses offered is the gift of time with patients. When I started early in my career, I was with a patient for 2 nights in a row. And the second night, this patient changed. They weren't conversing, they were just different. Something was off. All the data, i.e. vital signs, were borderline, but my gut said something was wrong. So I decided to have a courageous conversation. I was going to call the physician on call. My colleagues immediately looked at me and told me I was crazy. But I did it anyway, braced myself. The physician listened to what I had to say, listened to my observations, and decided, yes, we should do some investigations. It turned out that that patient was septic, which is really when an infection goes into the bloodstream. And the one thing we can assure you is the time from identifying sepsis and getting antibiotics on board saves lives. The time that was spent with that patient noting those changes saved a life. Eventually, I finished my Master's of Nursing Practice. I wrote my license to become a nurse practitioner. My role overlapped. I went into independent practice. I worked with physicians, I worked with nurses. I didn't really belong to any of those teams, I felt like. It took several years to understand that was a mix of the way I'd been treated in the past and carrying historical oppression that had really been taught to me by my own colleagues. It wasn't what nursing actually was. And a moment on an airplane changed that. I was on an airplane, I'd settled into my seat, had a nice glass of wine, and the announcement that every healthcare provider dreads comes on. Would any doctors or nurses please come to the front of the aircraft? Everyone sits in your seat, you sit there and you wait for somebody else to get up. Then nobody does, so you make your way to the front of the aircraft. And on the front of the aircraft, there was a woman unconscious, 96 years young, and beside her was an older gentleman. So I ask him, "Are you her family?" To which he says, "No, I'm a doctor." In my mind, I'm like, yes. Then what he says next makes my heart sink. "I'm a retired dermatologist." But what he says next will forever change my perceptions. I'm not comfortable with this. I've checked. She has a pulse. I'm really hoping you can lead this. This was very different because this was a person I didn't know from the hole in the ground. They accepted me for who I was without question and not having to prove a thing when a patient's life depended on it. The patient had an unfortunate mix of dehydration and low blood sugar, was sitting up in 15 minutes, emergency landing ensued, and all was well. After, I reflected on my role, and my reflection really evolved to tell me that what I was thinking about nursing, I had really let other people dictate what my value was. And that is not nursing. That was a perception that was not correct. I thought about how this came to be in the medical system. From a knowledge perspective, the evolution of healthcare has been tremendous. There has been a knowledge explosion over the last 100 years, and physicians quickly realized they could not know it all, so they specialized. You can see it doesn't even really fit on here because there's subspecialties within the small circles. Essentially breaking down the human body by system, which was absolutely necessary. But this is where nursing shines. We forget that most of healthcare involves medical questions, nursing questions, and countless other healthcare professions. Once we have a diagnosis, we need to help to understand the how from a holistic perspective, inclusive of the person, the environment, spiritual needs, so on and so forth. The what is next question. Once we've broken something down into parts for a diagnosis, how do we put it back together again? That's where the team comes in. You can quickly see, however, healthcare systems set up with healthcare members acting independently in their scope of practice actually does a tremendous disservice to everyone, including the healthcare providers and the patient. Yes, we can cure disease, but health is far beyond the absence of disease. There is no health without caring that is inclusive of the patient's voice and often several healthcare providers. Nursing has this caring lens to give to patients themselves and colleagues in a time where it could not be more important. As we struggle with unprecedented challenges in healthcare, we have to remember that because health is much more than the absence of disease, health is really a team sport. There isn't any one healthcare provider that can or should burden the entire patient's journey. We all have moments of caring to contribute to any person's picture of health and wellness. As healthcare providers, we also need to embrace this to protect ourselves. So I asked myself the same question. Why didn't I just go to med school? I share with you a team that I've worked with for several years, and this team has helped me answer this question. We work together, and we all bring something to that team, to each other, and the patient journey. Being a nurse practitioner, I've been able to maintain my identity as a nurse, but at the same time, be able to reflect on the views of the larger system and that the caring and the art of nursing are critical to the patient experience across the healthcare spectrum. With the overlap in roles, I am able to provide one critical lens amongst my colleagues of varied healthcare providers to support each other and improve patient outcomes. Because in the end, healthcare really is a team sport that includes all of us, including the patient. Thank you.